I'm Stephen Weber, MD, and I am Medical Director of Infection Control at Susquehanna Health.
What is the flu, or influenza, and why is it such a big deal this year?
The influenza virus is a respiratory virus that is a significant problem every year. The virus mutates, and so it's a different virus each year. And each year we come up with a new vaccine trying to target the projected strains that year. Usually we give that vaccine to people who are at highest risk, which would be the very young, the very old, or people with chronic illness. What's different this year is that starting this spring there was a brand new virus, the novel H1N1 or swine flu virus that was first reported in Mexico this past spring. Initially there were concerns that it was more widespread and more severe. And it actually did spread relatively quickly to the rest of the world, to the point that now we have what's called a pandemic, which basically means there's worldwide transmission of that virus. There are several things that make that significant. The first is that the seasonal influenza vaccine that is developed every year does not include this virus. The second issue is that it tends to affect much younger people, or predominantly more younger people, than the seasonal influenza. For example, in the state of Pennsylvania, and this is pretty typical nationwide, 3/4 of the cases described so far have been in people who are 25 years old or less. So that's quite a lot different. The third thing, and this is not absolutely certain yet, as I said, initially there were concerns that it was a more severe infection. And whether that's true or not remains to be seen. It's certainly severe. We're seeing plenty of people who are sick with it. It's not horrible yet, and the people who are most severely infected so far do seem to be people who are chronically ill, but we're seeing a lot more sicker young people than we usually do. Just to give you a couple of numbers so far, just numbers of confirmed cases. In Pennsylvania, there have been 8,500 confirmed cases as of this date. Now that really is just the tip of the iceberg, because those are just the absolutely confirmed cases, and there are dozens, if not 100 or more, probable cases for every confirmed case. A more realistic estimate would be currently the emergency room at the Williamsport Regional Medical Center sees 50 to 75 people a day for possible influenza-like illnesses. At Muncie Valley Hospital, in their emergency room, they see anywhere from 10 to 20, maybe 25 patients a day. Again, these aren't people with confirmed influenza. Some of them certainly don't have influenza, some of them do, but it gives you a better idea of the magnitude of the problem than just looking at the raw numbers. And there have been, nationwide, I think there have been 26,000 hospitalizations reported so far and about 1,300 deaths. So it's a significant illness. We're seeing levels of activity right now that would normally be high at the peak of the season. But the peak of the influenza season is not until February or so. So we don't know what the next few months are going to bring. Right now, H1N1, or the new swine flu virus, seems to sort of plateau. It's not going up week to week like it was for a while. Whether it's going to stay there, whether it's going to go down and go back up again, we don't know. And what seasonal influenza is going to do as the season unfolds, we don't know. To be honest, this time of year, frequently we haven't even seen our first influenza case yet. You see what we're seeing already.
What are the symptoms of the flu?
The symptoms are basically the same for both the seasonal influenza and the swine flu, or the novel H1N1. It's usually fairly abrupt onset, and the symptoms are fever, cough, sore throat, either a runny nose or a stuffy nose, headaches, chills, body aches, and fatigue. And usually you're pretty sick. It limits your activity, and most people, even if they wanted to continue going to work, feel bad enough that they stay home from work, which is a good thing because they shouldn't be out infecting other people. It usually lasts a few days. Most people are significantly better within 1 week.
How is the flu spread?
It's spread by droplets from either sneezing or coughing. and it can be spread directly. If I'm close to you and I sneeze or cough on you, it can go directly to your nose or mouth. Also, quite commonly, it might go to my hands, and then to your hands, and then to your eyes or your nose or your mouth. Occasionally, it might be spread from contaminated surfaces, but that's not nearly as big a means of transmission as the more direct person-to-person spread.
How can people protect themselves?
Well, that's in a way the good news, because basically by protecting yourselves, you're protecting others at the same time. So it's a win-win. Basically, you avoid crowds to the extent that you can. You avoid people who are ill. You try not to touch your face, your nose, your mouth with your hands, because that's a good way to spread either influenza or other respiratory viruses. Frequent hand washing is a good way to do that, either with soap and water, or if that's not readily available, with an alcohol-based hand sanitizer. The next way you can do that is to get vaccinated, both for the seasonal influenza and the novel H1N1.
What should people do if they get ill?
Well, if you get any of those symptoms I described previously, the first thing you should do is call your doctor or your healthcare provider. Depending on your underlying history, what other health problems you might have, and how severe your symptoms are, you may or may not be seen, but you certainly need to contact your physician or healthcare provider to take the first step to at least make an assessment over the phone and decide if a next step should be taken. Symptomatically, it's basically the things your mother always told you to do. Get plenty of rest, drink plenty of fluids. You can use over-the-counter medications for symptomatic relief. Another big point is to stay at home. Even if you might not feel bad enough yet to take off work, if you have symptoms consistent with influenza, you'll be doing yourself and all your other coworkers a big favor by not working. The same thing about not touching your mouth or your nose or your eyes, so you don't get the virus on your hands, where you're more likely to spread it to someone else. And also, you need to use proper, what we call now, cough etiquette. So if you sneeze or you cough, either catch it with a tissue, and if you do catch it with a tissue, then dispose of the tissue promptly, then wash your hands, either with soap and water or an alcohol-based solution. Or you can cough into your shoulder like this, or cough into your elbow like this. So those are kind of the common things that you would do. And you would stay home at least 24 hours after your fever is completely gone without the aid of medications. So if you were taking a medication for fever, it would be until you were off that medication and without a fever for at least a day. Now, there are a few things, though, that you need to watch out for, because it can occasionally cause more severe illness, and you need to seek attention promptly if that should occur. Things such as confusion, if you're getting dehydrated, if you're getting shortness of breath, if you're getting chest pain, those sort of things should prompt immediate attention.
What measures are Susquehanna Health taking about this flu?
Well, basically what we need to do is provide care to these people who are sick. And it is an increasingly common problem, and we have people in the hospital all the time the last few weeks who have influenza. So we need to provide them care, but do it in such a way that we don't give it to other people, whether it's other patients or our healthcare workers or our visitors or the community at large. So one thing we do is post signs at all the entryways that say, if you have these symptoms that suggest influenza, then don't come in the hospital. Turn around and go home, and if you haven't talked to your healthcare provider yet, call them to let them know what's going on. We're trying to limit visitation. In the regular floors, it's limitation of 2 people per patient and no one under 18. In the emergency room, it's only 1 visitor per patient, and again, no one under 18 if possible. Our goal is to try to provide the best possible care, but at the same time fulfill our mission of making this and keeping this the healthiest community possible.